Dr. McIntosh with your tip of the day. There are several different ways of getting relaxed or partially asleep or fully asleep for your procedure. One way is local anesthesia. That is where medicine is injected into a localized space and only that area is numbed up. Another is topical, and we can put topical on the skin, and that helps to numb the skin wherever that's placed. So it's another version of a localized anesthetic. Then there is a regional. Regional is when, let's say, an entire zone is addressed because large nerves are anesthetized with an injection. You can even do that with an entire leg or an entire arm and have your surgery on that leg or arm awake. Then there's IV sedation. You can get IV medications that, we call that twilight. And usually that's a combination of like Versed and fentanyl, something like that. That helps people get real relaxed and forgetful. I just had that last week with my colonoscopy, and there's a lot I don't remember. So I did great with that. You can also do quite well with an oral medication to get you just as relaxed, but also kind of forgetful. And that helps people get through minor procedures like a blepharoplasty or some liposuction. In addition to obviously a local anesthetic to numb the tissues that we're operating on. Then there's a spinal. Spinal anesthesia is where the anesthesiologist injects the medicine into the spine at a certain level, and the nerves that are in that area all don't work. And so, we know this like when women get it for a C-section, for example, and then their legs are numb and they can't walk, but you don't feel when they cut your belly open and remove a baby. So that can be really great. And then there's general anesthesia. And general is where it's IV and inhaled and all kinds of stuff. And you're supported by an anesthesiologist and a breathing machine and oxygen and all kinds of things to get you through a longer procedure typically. So we're generally going to use general anesthesia for something that's going to last a few hours, and we don't want the patient moving at all, and you want to be really comfortable. So there's lots of options out there, and talk to your doctor about which ones are best for you and your procedure.